Hey guys, this is Dr. Hill from Rayford Animal Wellness Clinic, or ROC, where pets aren't just cool, they rock. Hey, so glad you're joining me today. I wanted to do hopefully a quick talk. I tried to do this a little bit earlier and it took quite a while, so we'll see how this goes. But I wanted to go over what a physical exam is. I had somebody ask me after I got done, I looked all through their kittens, they were adorable, and they said, well, what all did you do? And I thought, oh my gosh, you were here, like you just saw me do all this work, this evaluation, and then I realized I do talk through it a lot, but unless this is, I mean, it's such second nature to me that how many things we're looking at through that physical exam, it's actually kind of mind-boggling. The thing is that our pets can't talk to us, right? So I have to use a lot of information, of course, all of the history, everything that you can give me. And the biggest things, what's going in, what's going out, are they feeling good? Are they acting good? Are they losing weight? Are they gaining weight? Any stresses, things like that really help me. But a huge part of what I do is the physical exam with your kiddo in front of me and really examining from the tip of the nose to the tip of the tail, like all the way through. And I pretty much do that every time you visit because, again, they can't talk. And so things could be changing, and unless we're really being vigilant about full evaluation, we could miss something. And so yeah, so I even start before we start the hands-on physical, like when you guys walk in the front door, when I see your pet moving, that tells me a huge amount of information of what's going on in the brain, all the way, to the limbs and the body. And, that's something I think we all take for granted is how your brain is telling. I mean, that's amazing. The information that's passing through, and that there's so many connections that have to be working properly for that to happen. So it's an amazing thing. And, it's just something we expect. But we're looking at that when your pet comes in. We're also looking for signs of pain or limping or, just anything that we don't have a normal gait, that the nerves aren't firing correctly. And so, yeah, that's something huge that just by walking, we can get some information about the neurologic system and about the musculoskeletal system. So something we look at immediately. Then I start the exam usually, and we'll start with the nose. And we're looking at, the pattern on the nose that you usually see. We're looking at the coloring. Is there any irritation? Is there any discharge? Anything in the nostrils? Just starting with that simple thing. Start at the nose, and then we start working our way through the head. Go to the teeth usually. So look at the mouth. And we always think of dental disease. Of course, we're going to check for that. We're going to look for tartar on the teeth. We're going to look for inflammation in the gums. We're also, though, and that's super important, we're going to look for masses in the mouth or any abnormalities on the tongue. We're going to look for the color of the gums is actually huge. So if the gums are, usually they should be pink, right? And then I touch the gums, and there's multiple things we're doing with that. I'm looking at, does the color, when you touch it, the color's gonna go away, and then it should come back really quickly within less than 2 seconds, and that tells me there's usually good blood flow. So good, tells me something super quick on how the blood is moving through the body. We also look at color, so they should be pink. If they're too white, we could be really anemic or in shock. If they're too red, we could have an infection. If they're yellow, we could have liver disease. So if they're blue, we're not breathing, we're in trouble. Heart disease could be something, or toxicities and things. So actually the color of the gums, that's such a quick thing, and it tells us so much information. And so, yeah, we check all that out. We look at the eyes, and for the eyes, it is hard as a general practitioner to really get into the eyes. Sometimes I do have to send you to a specialist for that if we're having blindness issues. But we look at the whites of the eyes, the sclera, for redness or irritation. We look at the eyelids, the eyelashes. We look into the pupil and make sure when the light hits it, it constricts, and watch the other side as well as we do that, to just make sure that, again, that's another neurologic thing. The eyes are the windows to the soul, of course, and they tell us a lot about the health of the body. Sometimes there's information we can gather, and that's a neurologic thing, to get those pupils to respond. You also, we can look at the retina sometimes and see if there's inflammation or other problems going on in the retina that tells us a little bit more even about fungal infections and things like that, or cancers. Sometimes we can see some evidence of that. So the eyes are really important, and really important to our physical exam. Next, I'll check out the ears, and ears, I'm probably mostly looking for signs of infection. Usually you're going to tell me that. You're going to be like, oh, they're scratching and keeping me up all night, or I can smell it's smelly. And so we'll look in there, we'll look into the ear, because even what you can see on the outside, sometimes you can see wax and inflammation. You can see that the skin is thickening. That's pretty bad ear infection and irritation. But when I go in, we look at the tube basically, and then we look at the tympanic membrane or the eardrum to make sure that it's looking normal and that we can see it's intact. So yeah, looking in the ears can tell us a lot. Now, the frustrating part about looking in the ears is it cannot tell us a lot about hearing. So sometimes, especially around 13, I feel like people start to tell me their pets don't hear as well, and that's always so frustrating because there's really not a lot we can do. But if it's due to infection, we can treat that. But a lot of times that's a aging change. So we can't always tell a lot just by looking for that one. Usually going to tell us. But if we see signs of infection, we're going to do an ear cytology, check that out. We're going to get a little Q-tip out, and we're going to check it out on the microscope and see if it's bacteria or yeast, and we're going to clean that up and get some treatment going. And a lot of times if the ears are infected, this is a sign of allergy. So we'll look for signs of that in the rest of the body, in the skin in particular. And I'll go, so after the ears, and we'll, do we see allergies? Do we see infection? We'll get that all going. We are going to feel and look at the skin everywhere, looking for lumps and bumps and, inflamed skin, itchy skin, especially since we talked about the ears, especially we call it the dorsocaudal back, so that right by the tail head. Like if that is missing hair and they're super itchy, that's a huge sign of fleas. If you see that on your dog, make sure you don't see any fleas and get good flea meds on, because that's one of the first places we see that hair loss and that itchiness. And so that's a key. We'll be like, oh, we got to get some good flea meds on too. And so that can definitely help, because who wants to spend a bunch of money trying to figure out allergies when it's just some fleas and we can just get rid of them with good medication. But other places we can see sign of allergies, the feet. So if the feet are really inflamed and you're telling us, oh my God, they're chewing, either way, just, we look at kind of the armpits or the axilla, and then we look between the legs or inguinal area and the belly, looking for signs of inflammation and irritation and itchiness. So those are huge areas of, to let us know we need to think about allergies. And it can be environmental, it can be fleas, it can be food. We'll just start going down the list, trying to narrow it down and figure out what's going on. But my exam, looking at the skin and everything, I'm also going to check out some really key points in the body. Right here, we have some lymph nodes. They're called the submandibular lymph nodes. We're going to feel for enlargement there. That can be due to infection, but it could also be due to a lymphoma type of cancer. So we want to make sure that feels nice and normal. And if you ever feel anything in that area, swelling or anything, let us know. There are other reasons that can be big as well. The salivary glands can be inflamed and things. So just if you notice it, we need to check it out. That's all that means. So get in if you can. There's also some kind of right here called the prescaps. There are some behind the knees called the popliteals. We will check all those areas. There's also some kind of in the inguinal. They're a little harder to feel, but we're going to palpate everything, and feel for any of swollen area, also other masses. And listen, if you find something, mark it, or shave over it before you come, because you will feel that, especially these really furry guys. I'm like, you could feel all day. And a lot of times people come and they're like, I can't find it now, so it's something small. So while you're at home, if you just grab a marker or shave over it so that you know exactly where it is and we can find it. We'll check out any lumps and bumps. A lump, well, a lot of times I'll want to stick a needle in it unless it's really small. Those are usually little kind of warty things. I'm not too worried about. They're usually benign, but show them, let's look. But if it's a bigger lump, I'm probably going to want to do a cytology, which is where I stick a needle in it and I pull cells out. We look at that under the microscope to give you an idea of if it's cancerous or not. Hopefully not, right? Or sometimes for me it's questionable and I'm like, I can't really tell and I want to be sure. And I might recommend sending that to a specialist for further review. But sometimes we can easily tell. And sometimes it's a cyst and we just get material out, or sebaceous cyst, which is kind of an oil gland, is overproducing. You get this grody, white, cheesy kind of material come out. It's good times. It's kind of like the pimple popper lady. Like, it's really satisfying to get those out, though, I gotta tell you. Oh, and we even get really cool things, like maybe kind of gross, but kittens will sometimes get what's called a cutoribra. It's basically like a larva in there, like it'll even kind of poke its little head out, and we'll need to remove that. So if you see a big spot on a little kitten, definitely let us know, and we'll check that out. So yes, we'll look for all these things. You won't need to worry about that. We'll do all that. And then I'm going to go through, I'm going to feel everything. I'm going to listen, of course, to the heart and to the lungs. So listening for heart murmurs, irregular arrhythmias, listen to the lungs for crackles or just anything abnormal. And we're going to check that out. If I hear anything, a lot of times we're going to want to do some x-rays. If I'm worried about the heart, we may want to do an echocardiogram or, check that out further, ECG, those kind of things. I'm then going to palpate the belly. And when I palpate the belly, I'm not just petting. A lot of people are like, yeah, I feel their belly all the time. I am actually really squeezing a bit in there. Every once in a while, a dog will be upset with me for that. But what I'm trying to feel, I'm feeling intestines kind of roll through my fingers. I'm feeling for masses. I'm feeling for anything in the belly that feels abnormal. I'm trying to feel the spleen. I'm feeling a little bit of liver. Trying to get up in the kidneys. Cats are way easier than dogs, especially if the dogs are overweight, which is another thing we're looking for on our physical exam, right? If I feel anything in those intestines or thing, of course, we'll talk about it and maybe do some more x-rays and, go from there. If we're overweight, and let me tell you how I check that out, because you can do this at home. You don't even need a scale. What you want to do is have your dog stand and feel over the ribs. You should feel ribs pretty easy with a little bit of fat, not much though. And it shouldn't be a lot of fat. You shouldn't really have to squeeze, okay? You should be able to look at your dog from the top and see a little waist, and you should be able to look from the side and see a little tuck underneath, right? And if you can see those things, we're probably doing pretty good. If we got a little too much, we're going to talk about it. We're going to go over some things we can maybe do to help lose a little weight, and that is huge. In some research, dogs lived an average of 1 to 2 years longer when they were kept thinner than dogs that were allowed to get a little heavier in some research done by Purina. So pretty awesome stuff, and really encourages good body condition. So we'll then go to the legs. We're going to check out the front legs and the back legs. We're going to put them through normal kind of walking motion. We're going to, again, watch that we're placing the feet appropriately to let us know the nerves are working. We're going to feel the knees, because little dogs tend to have a luxating patella, where the kneecap moves around a little bit, and that can cause arthritis. And bigger dogs, hips, can bother them. And the spine, we'll go down the spine. Those little dachshunds are prone to spinal intervertebral disc disease and things like that. I do pull the legs out pretty much kind of all the way to just make sure they're moving good. We'll feel the tail, we'll look at the booty even, we'll get inappropriate sometimes, even to doing rectals if we need to for those older male dogs that are especially intact or having any problems defecating or urinating. That can be very important. And then we'll check out the rear, we'll check out the penis, the vulva, make sure everything looks nice and normal and doesn't look inflamed or irritated. So I think that's a pretty good explanation. I'm sure I've missed some things because there really is a ton going on. But if we can check out all those things in our physical exams, again, hopefully we can catch things early, get them treated, and keep them healthy as long as possible for you guys, so you can have as much fun as possible. So that's a physical exam, at least my physical exam. Everyone's going to have a slightly different version, but I really hope this helps, and I hope you have a great one. Thanks a lot. Bye.